Welcome to the We Level Up Treatment Center video series. In today's video we will discuss alcohol poisoning symptoms, signs, cures, effects and what to do. Drinking a lot of alcohol quickly can have dangerous, and even fatal, side effects such as alcohol poisoning. A coma or even death may result from consuming too much alcohol too quickly, which can also affect your respiration, heart rate, body temperature, and gag reflex. Severe alcohol intoxication necessitates immediate medical attention. If you believe someone may have alcohol poisoning, call 911 to obtain immediate emergency medical care. When to visit a doctor for alcohol poisoning. Not all of the warning signs or symptoms of alcohol poisoning must occur before you seek medical help. It is important to note that patients with alcohol poisoning who are dozing off or who cannot be awakened run the risk of dying. Alcohol poisoning is an urgent situation. If you have any suspicions, even if you don't notice the classic symptoms or indicators of alcohol poisoning, you should get immediate medical help. What you need to do for alcohol poisoning is dial your local emergency number or 911 right away. Never rely on someone recovering from alcohol poisoning to sleep. Be prepared to share details. If you are aware, be sure to let medical staff or emergency workers know what kind, how much, and when the patient drank alcohol. Never leave a person who is unconscious alone. Someone with alcohol poisoning may choke on their own vomit and become unable to breathe because alcohol poisoning alters how the gag reflex functions. Don't try to make the victim throw up while you wait for assistance. You risk making them choke. Help someone who is throwing up. Make an effort to keep the person seated. Turn the person's head to the side if they must lie down. This will help them from choking. In order to prevent unconsciousness, make an effort to keep the person awake. Do not hesitate to seek support. When deciding whether you believe someone is drunk enough to need medical assistance, it is best to err on the side of caution. If you're underage, you could be worried about the effects it will have on you, a friend, or a family member. The consequences of waiting too long to get the right help could, however, be considerably worse. What are alcohol poisoning symptoms? Common alcohol poisoning symptoms include vomiting, confusion, slow or irregular breathing, pale skin, seizures, low body temperature, and unconsciousness. If any of these symptoms are experienced, it is advised to get medical help right away. What are the different levels of alcohol poisoning symptoms? The signs of alcohol poisoning can appear quickly and suddenly. As a result, you might experience various alcoholic symptoms when you drink. Depending on the degree or stage of drunkenness, these symptoms will vary. Each person's level of intoxication differs according on their age, sex, weight, and other factors. The 7 stages of alcohol poisoning are sobriety or low-level intoxication, euphoria, excitement, confusion, stupor, coma, death. What are the causes of alcohol poisoning? In the US, a standard drink has 0.6 ounces of pure alcohol. This much alcohol is typically present in 12 ounces of beer with a 5% alcohol content, 8 ounces of malt liquor at a 7% alcohol content, 5 ounces of wine at a 12% alcohol content, 1.5 ounces of 80 proof distilled spirits or liquor such as rum, vodka, or whiskey at a 40% alcohol content. What's the difference between alcohol poisoning symptoms versus being drunk? The symptoms of alcohol poisoning can be severe and may include confusion, vomiting, stupor, slowed breathing, low body temperature, seizures, blue, tinged skin, and even death. Signs of being drunk can include slurred speech, impaired coordination, confusion, difficulty walking, and poor decision making. What are alcohol poisoning symptoms the next day like? The most common symptoms of alcohol poisoning the next day include headaches, nausea, vomiting, fatigue, dizziness, sweating, and lack of appetite. If you think you or someone else has alcohol poisoning, it's important to seek medical help immediately. What you need to know about the short-term health risks of drinking alcohol. Immoderate drunkenness has rapid repercussions that worsen a number of severe health issues in addition to the symptoms of alcohol poisoning. These include the following and are most frequently brought about by excessive drinking: injuries, such as motor vehicle crashes, falls, drownings, and burns. Violence, including homicide, suicide, sexual assault, and intimate partner violence. Injuries, such as motor vehicle crashes, falls, drownings, and burns. Violence, including homicide, suicide, sexual assault, and intimate partner violence. Risky sexual behaviors, including unprotected sex or sex with multiple partners. These behaviors can result in unintended pregnancy or sexually transmitted diseases, including HIV. Miscarriage and stillbirth or fetal alcohol spectrum disorders, FASTs, among pregnant women. What are the risk factors for alcohol poisoning symptoms? Alcohol poisoning symptoms can be more severe in some people than others. Your risk of alcohol poisoning is affected by the following variables: your body type and weight. More prominent people absorb alcohol more gradually than smaller people. Your health status. Having particular health issues can put you at greater risk of alcohol poisoning. Whether or not you've eaten. Having food in your stomach before drinking can slow your body's absorption of alcohol. Whether you've blended alcohol with other drugs. Consuming certain drugs before drinking can double your risk of alcohol poisoning. The percentage of alcohol in your drinks. Drinks with a higher rate of alcohol will raise your blood alcohol level faster than drinks with a lower percentage of alcohol. Your rate and amount of alcohol consumption. Gulping many drinks down puts you at risk of alcohol poisoning. Your level of alcohol tolerance. People who frequently drink are better able to tolerate alcohol than people who are only occasional drinkers. What are the complications of alcohol poisoning symptoms? The following are some major side effects of alcohol poisoning symptoms. Choking. Alcohol may make you throw up. You run the risk of choking on vomit if you pass out, since it inhibits your gag reflex. Stopping breathing. An unsafe or fatal breathing interruption might result from unintentionally inhaling vomit, asphyxiation. Extremely dehydrated. Dehydration brought on by vomiting can cause dangerously low blood pressure and a rapid heartbeat. Seizures. Seizures could result from a drop in blood sugar that is severe enough. Hypothermia. Your body temperature may drop to a point where cardiac arrest results. Abnormal heartbeat. Alcohol poisoning may result in heart stopping or beating erratically. Brain injury. Drinking excessively has been linked to permanent brain damage. Death. Any of the aforementioned problems may result in death. Alcohol poisoning symptoms prevention tips. Avoiding alcohol poisoning symptoms by: if you do consume alcohol, do it in moderation. If you decide to consume alcohol, do so sparingly. That means that for healthy individuals, women of all ages and men older than 65 can have up to 1 drink per day, while males 65 and younger can have up to 2 drinks per day. When you do consume alcohol, savor it thoroughly. Never drink on an empty stomach. Having some food in your stomach may help to slow down the absorption of alcohol, but it won't stop alcohol poisoning if you're binge drinking. For instance, talk to your teenagers. Inform your kids of the risks associated with alcohol, such as excessive drinking. According to data, kids who report having close ties with their parents and who have received alcohol-related warnings from their parents are less likely to start drinking. Safely store your alcoholic items. Store alcohol-containing items, such as cosmetics, mouthwashes, and prescriptions, out of the reach of small children if you have any. To keep children from accessing household cleaners, utilize the child-proof bathroom and kitchen cupboards. Keep dangerous objects safely out of reach in your garage or storage space. Think about locking up your alcoholic beverages. Get follow-up treatment. Ask about follow-up care if you or your kid has received treatment for alcohol poisoning. You can avoid future binge drinking by scheduling a consultation with a health expert, preferably one who has experience treating chemical dependency. Get the treatment you need for alcohol poisoning. It takes time to recover from an incident of alcohol poisoning symptoms. Prior to their vital signs returning to normal, you will be admitted to the hospital. This could require days or even weeks. During recuperation, you can experience pain, discomfort, and memory issues in addition to a depressed mood and appetite. Even after leaving the hospital, it may take up to a month before you feel well again. The good news is that, with timely and adequate medical care, alcohol poisoning symptoms can often be avoided. Detox for alcohol poisoning. What to expect? Alcohol detox can be risky, especially if it is carried out without a professional's assistance. Delirium tremens and other withdrawal symptoms can be dangerous and even fatal for a client who is detoxing. It is therefore advised to detox at a rehab facility with access to knowledgeable staff who can handle any signs of alcohol poisoning and withdrawal issues. The medically assisted detoxification procedures enable the body to eliminate alcohol from the system and gradually wean it off its reliance. Long-term addicts who use heavily typically have more severe withdrawal symptoms, which makes the procedure more challenging for them. The detoxification procedure may make the symptoms appear to worsen. To aid with symptom management, they require ongoing care and attention. Treatment for alcohol poisoning symptoms is available so that your recovery process may get off to a comfortable and secure start. That's it for today. If you like our video, please like and share our video and subscribe to our channel. Have a great day.